Well, hello everybody. Welcome to another episode of We Are McGill Social Work. Today we have an exciting episode with one of my favorite teachers, Professor Alicia Kyte. Welcome, Alicia. I will ask you to introduce yourself a little bit, tell us a little bit about you, how you doing, and then we'll go into who you are at the school or as a social worker, and then we'll have just a little chat about you so that people can get to know you. So welcome.
Thank you, Alice. Where to start? I'm a new professor, I think still new. It's been 3 years since I've been at the School of Social Work at McGill. It's March, so it's almost the end of the semester. Looking forward to summer. Other than that, a little bit about me. Before coming into this position, I was a social worker for many years. I started my career as a social worker, and it's been that's what's been motivating me, I would say, to pursue doctoral studies and to be where I am right now within the school.
Well, thank you. When you said I was a social worker for many years, it just brought me back to I think last year when we were doing the course for practice with individuals and families, and we had a role play, and it felt like we were like in therapy. At some point, we kind of like I shared that with some of my classmates. It felt like you were bringing us to tears with the way you were asking the questions, the way you were putting in the pauses. So with that being said, I think you are an amazing clinician. So you have been a McGill for 3 years, but before that, would you like to share a little bit about what were you doing before and how your social work journey in those many years had been, and where were you working? And yeah.
So I started actually at the McGill School of Social Work. So that's where I did my bachelor's in social work.
Awesome.
And I graduated at the tender age of 23. And I did my last field placement as a block field placement at Bagshaw. And after I finished my block, they hired me. And so much of my career has been in child protection, working within Bagshaw Youth and Family Centers. But what's nice, I think, about this profession is that it's so versatile that even when I was working there, because I was working there at sometimes full-time, but also sometimes part-time. And so I was also in other organizations. That's what I always say to students, like there's so much work out there if you want to do that work. And so I had the opportunity to work as a crisis counselor in a mental health center. I also worked with TAVAC, which is for victims of criminal acts. I worked for a long time also with the Sexual Assault Center of Montreal as a rape crisis counselor. I also worked with older adults on the elderly abuse line. I've worked as a school social worker. Yeah, I've done a lot. I've worked at the CLSC. It's actually a little bit scary as I'm like talking about it. I'm also realizing that I'm getting older. I'm getting older and wiser. Yeah. And it's just kind of like, whoa, I actually have a good solid almost like 15-20 years under my belt. And I like, as I'm talking to you and I'm looking at you, I'm just like, I remember when I was at the BSW and I had just started, and it just felt, it's surreal. Anyways, it's surreal, but here we are. And so yes, so bachelor's of social work at McGill, and then I came back and did my master's of social work at McGill. And then I was like, I'm done with school, and I'm just gonna, I'm just going to continue working And then I realized, actually, no, I want to do something else. I think I was feeling frustrated at the time with just the repetition that is social work, especially in the department where I was at in child welfare. And so I decided to do a PhD. And now I can say, like, yes, this is where I feel the most satisfied in my work as a social worker.
Let's talk about that. Um, why at the PhD level that you felt like was more satisfying?
Because I feel, and maybe I don't know if it's my own kind of false belief, but I feel that this is at this stage in this place. This is where I'm able to affect the most change. I mean, I think you know what my agenda is in terms of, wanting to achieve like liberation and emancipation for the Black community. And so a lot of my research has been on how the child welfare system as a carceral intervention has led to the overrepresentation of Black children within the system, and how this is a form of anti-Black racism. And so it started off there, but then as I've kind of, I guess, been expanding and having the time, that's the other thing, is that being on the ground, you have less of that time to really see and understand and look at what other people are doing and saying and writing about, things like anti-Black racism. So I like that I'm no longer perhaps responding to the consequences of that, but thinking about it and seeing how it's not just child welfare, it's also our criminal justice system, it's also our education system. And so being able to look at that and understand, and also, oh my gosh, at least I'm gonna go off topic all the like
It's
you shouldn't
okay,
have
take
asked.
it where you want.
Oh, I'm taking you on this, like you shouldn't have asked me this question, but I just feel like, also a lot of my stuff has been kind of like trying to document in the form of numbers anti-Black racism. So that's where I was like, I'm gonna because I felt, I think, leaving my work as a clinician, that I had all of this like anecdotal knowledge. So like, yeah, you know, Black families are being overrepresented, aren't understood by the system. But it was all like I could only speak to what I had seen in my clinical practice. And so what excited me about doing doctoral studies is that I was going to be able to document it like for a population, like at a greater level. And so the first part, I would say, of my PhD and my career, although I'm at the first part now, but just as I was transitioning from PhD student to, new faculty, it was a lot of this like, okay, documentation. But now I find myself drawn to documentation in the form of amplifying the voices of those people who are experiencing anti-Black racism. And so like I'm still on this journey, but all this to say that I really feel that where I am now is most satisfying to me as a social worker, because I am at the same time advocating for change through research, but also still listening and hearing the voice of the community through my various like projects that are very much community based and focused.
So do you think that there's the way you approach that as a PhD student and now a doctor, that gives you an entrance to that? Or is it maybe your many years of experience working first and gathering what things, like how things looked like before, that gave you like the power to do that, or is it the work you did in a PhD? I'm just trying to compare maybe for like a student who's going to do their master's then a PhD. Do you think their work would be as impactful if they hadn't worked that as many years as you did before? You know, I'm drawing to the conversation that we had in one of the classes prior to this about micro and macro, which one is more impactful, which one can actually lead to change, you know, and not leave you frustrated. I like to hear that you are feeling satisfied and you're fulfilled in your work. Do you think it's because you did micro first, or would that be equally as satisfying for someone else?
Yeah, that's a really good question. I think a lot of people, so I say that I'm a social worker, I'm still a social worker. And I'm a social worker that is doing research. And research for me, at least how I do it, the relationships that I form, like I feel like I'm still using those micro social work skills. And so it's absolutely beneficial to have had that clinical experience, also because it provides, I think, with a better understanding of the system, especially since my research, you know, if I had done a PhD, or if I was a researcher who wasn't interested in, you know, the child welfare system or in anti-Black racism, but had like branched off into a completely other discipline, perhaps then my clinical experience would not have been as useful. But because of, you know, my experience working in the system, I think that it allows exploration of data and of narratives that is a lot more in-depth, nuanced. I think the questions, you know, it also influences the questions that I ask and how I understand. Like, for instance, just like a given example is before, you know, before I think being in the space of research and reading and hearing, a lot of the time I would think about overrepresentation as just that, you know, overrepresentation of Black youth in the system because of things like poverty. And that's kind of what the literature has said. But I think using the voices and hearing from the families and seeing and having the time to reflect and learn from what's been done by other researchers, where anti-Black racism is a lot more spoken about. It's allowed me to see that overrepresentation as anti-Black racism. And it seems like as I'm saying it, it's like it seems like such a easy shift to make, but it wasn't for me. Or, you know, I think it's only because I'm being in this space that I'm then able to make sense of that and to then use that in my research with participants and how we think about their involvement with the child welfare system, their involvement with the juvenile system. And also then, you know, I think it gives me credibility as well in terms of, you know, I like to say that I've got 15 years of experience working as a social worker. So when I say, you know, what I say, it's not just based on, you know, theory. It's based also on my experiences of being in the system, and also my experiences of being, you know, a Black woman, and also from what I've heard. And so in some ways, I really see that as, you know, starting, I think, a relationship with research that isn't necessarily from the beginning, but comes from, you know, being in that system and knowing what questions to ask, and making better sense of the experience in terms of how we analyze that data, how we understand that data. Yeah.
Yeah, it gives you lived experience data, I would say, and ties in the community and a lot of credibility. For me, when I hear that, I'm like, I'm not just learning from or participating with someone who's just read the papers and compiled them. I'm participating with a social worker who has actually lived in a community and worked in a community. So yeah, thank you for sharing that. Before I ask you about your teaching role, can you tell us a little bit how the research is going? How's the journey to your PhD and your research? I understand that it's still going on, like it becomes part of your life and your professional career. How is it going? Is it going well? What are the
Yeah.
aspects around that? And
So it's going really well.
mm,
I'm really excited about some of the projects that I'm working on. So there's like a transition, I guess. Maybe everyone goes through that. I don't know. But as I was doing my PhD, I was very much, like I said, focused on some of the quantitative, so documenting and looking at the data from a numbers perspective to demonstrate, hey, yes, there is overrepresentation, and hey, yes, there is something called the differential trajectory for Black children. They're more likely to be placed in foster care, experience instability in their placements, less likely to return home. They're more likely to be referred to the juvenile justice system. So that has been like, I think, a lot of just like documenting that. But then I think I realized like this is not new because it's been done in the United States. And I think what I've now understood is that things like anti-Black racism, these are like worldwide, right? This is like world experiences. And so I don't expect there to be a significant difference between, what we're finding here in Quebec and what's been documented for decades in the United States and elsewhere. What I think then becomes really imperative, and what I'm realizing is not so much what the numbers say, but how it's lived, and the particularities of context, and how within the Quebec context, that experience, that lived experience for those families might be very different because of language, because of citizenship, because of the current like political context, and so in order to get that really rich data of how it's lived, I've kind of been transitioning to a lot more qualitative data, and uh, taking the time to hear the narratives of the participants. And so right now, in order to access or in order to have those participants, it's not like you can just go into a community and be like, hey, please talk to me. You have to have relationships. And so it's been, I think, this past 3 years, nurturing the relationships I had already developed, but also forming new relationships with other community organizations, those that are, I'm English speaking, but I'm in Quebec, and the reality of English speaking Black Quebecers is different than French speaking Black Quebecers. And one of the things that I, wanted to do is to, if I want to understand what is like the Black experience in this province, then I need to be able to, seek those ways that the experience differs as a product of, let's say, ethnicity, language, immigration. And so that too has been, how do I bridge those connections? Because even though I'm Black, I'm still an outsider, from other Black communities. And so trying to make those relationships, but also trying to do ethical research. And so my research is very much driven by what is the need in the community. And so the last couple of projects that I've applied for funding for have been motivated and have been the community asking me, we want to look at this. We want to know about how the Haitian community in Rivière des Prairies, how the youth in that community are doing. Or we want to better understand this program that we've implemented for Black families, because we're applying for funding and they're always asking us for data or for evidence. Okay, so let's think about how we can do that, how we can get that data with funds and do that evaluation, or show how we can push forward this really innovative project that you have. So it's been a lot of, I would say, I think I just forgot the question you asked, Alice. But
yeah, we were talking about like community involvement and how the research is going.
The research,
yeah,
so it's going, and it's a process, and it's a process that I'm enjoying. And it's not easy. It's not an easy process either, because the community has their priority and also their capacity, right? And they don't always, most of the time, they don't have the capacity to, participate in these like research projects. And so it really, I think that's where it feels like I'm still a social worker on the ground, because I feel like I'm still, whenever I meet with community partners, I mean, now it's Zoom, right? But the last couple of meetings, whenever I meet with them, I'm always going into the community. I'm going to their organization. And we're like, when I have them, like, it's not like, okay, let's meet for an hour and then I leave. Sometimes it's like, all right, let's meet for an hour. And it's like, I've been here for 3 hours. Like, all right. And the last time I went, they were like, yeah, you should know, Alicia, like, whenever you plan to come see us, like, book your calendar for like, 3 hours better than one, because you'll never leave in an hour. And I'm like, got it. I will do that. But, I'm just so amazed in some ways, even as a social worker, I was very much working in the institutions, and I wasn't really, I think I was referring out to community. And I thought that I knew how community worked. But it's through this experience, going into communities as a researcher, that I'm like, oh my goodness, now I understand how community works and how they see things. Like, we're so behind. Our institutions are so behind. The community, they are the ones that are, able to tell you this is going to happen. We're concerned about this. It comes to them first. And the wealth of knowledge that those workers have is just phenomenal. I could like give another example, but I don't think it's as as related, but just when you hear community talking about the things that you're reading about that was recently like published, and they're like talking about it, they're not using the same words, but they're describing the same things. It's just like, oh my goodness, it's so a lot of what I'm doing as a researcher is trying to include that expertise of community in what I do. So bringing them to the table in terms of, all right, we've got this research project. I'd like to be able to hire you as research assistants. So hiring those workers as research assistants, bringing the data to them, analyzing the data together, getting them to, help with conducting the interviews. So all of this is my vision, and it's what I'm trying to do right now. But it's a bit of a struggle because I don't know, I mean, I'm struggling because hiring community workers, like, yes, it's great to say hiring community workers, but there are all these administrative stuff within the university in terms of okay, if you actually really want to hire these street workers, you have to get them to apply and have their CV and they're just I wish I could just kind of pay them, or if there's a way to work around it. But so some of the administrative hurdles for doing this work is kind of similar to administrative hurdles that you experience as a social worker. So this is where I'm saying that a lot of what of how I practiced and how I managed, advocacy as a social worker, I'm finding I'm using some of those same skills. It feels familiar to me. It feels familiar to me as a researcher.
Yeah, I was going to ask you if you have a team and what that looks like. So I'm understanding that you will be the main researcher, and then you would have preferably community partners who will be your research assistants. Do you have students that work with you, and how does that work really, so we can get an insight on what that looks like in leading a project like that?
Yeah, so I can explain to those who might be listening what that how it looks like to be or to call yourself a researcher. So in order to do this, you have to have money. So you get the money from writing a proposal. And so your proposal, you submit it, they evaluate it at there are a couple of federal funding agencies and provincial funding agencies that review proposals and then decide whether or not you can be funded or not. And in the proposal, you have to basically, demonstrate what it is that the question and what it is that you're seeking to understand. And you also have to show that the funds are going to be used to support students. And so a lot of the research that I do is about is student involved. And so as the principal investigator, there's myself, but there's also co-investigators. So you can work on these proposals with some of your colleagues. And so I am a principal investigator with a couple of colleagues here at the School of Social Work. And so while I might lead, I might call on them for assistance, and everything budget and hiring of students, it usually goes through the principal investigator. And so I have, postings, sometimes you've seen them, for students to apply. Have to be honest, sometimes it's difficult because a lot of my projects are with the Black community, and and also I told you I wanted to branch off into the Francophone community. And so there aren't that many Black Francophone students coming through the School of Social Work. And, representation is so important. And so that's a bit of a challenge in terms of finding students, but I have managed to find some students, and also, getting to know the students as well. Sometimes, I find our students are super busy. So I've approached students and it's yes, I would, but I'm so busy because I'm doing my undergraduate degree and I'm working part-time, and it's just capacity. That's the one thing I've noticed, I think, about the students within our school. They're brilliant, but they're also hustling, right? They're surviving. And so they are working, and I don't know if they necessarily have the time, with field placement, with school, with their part-time jobs, to take another part-time job. as a research assistant. So that's a bit of a struggle. But I also, I'm trying to work with community, so hiring community workers, those organizations, to see if I can get some funding for them to do this work on top of their work. And hopefully that can be a bit of a incentive for them. The incentive is also that the question, oftentimes it comes from them. So they're also invested in participating and in seeing, what can be done to move it forward, because the results and the findings will be pertinent to them. Yeah.
Thank you. Thank you for sharing that. It gives us a clear picture of what that looks like. I'm also pleased to hear that community organizations can approach a researcher to say, hey, can you help us look at that? I hadn't thought about that. So I always thought maybe the researcher comes up with a question and then goes with it. So I like to hear that it can be the other way
I
around.
would say that, it's not every, this is one of the things I think that we do poorly in the academy, is that there's often a huge space right there between community and academy. And it's not true that all organizations can come into the academy and say, hey, oftentimes they can't. But I think that as researchers, we each can decide what our program of research and our way of conducting research will be. And so for me, it's very much important for my research to respond to the needs of the community, and for it to be community driven. However, in the academy, that's not something that's necessarily prioritized, because one, it takes a lot of time, and two, because it takes a lot of time, the research output is slower. And as professors, new professors, what happens is that if we aren't able to produce a certain amount during a certain time, we could face consequences in terms of our ability to stay in the academy. And so in some ways, a lot of this community-based research is, it's not prioritized. I think there's a desire. There's definitely a desire, but a lot can be done to better ensure that if we do decide to do this and to be in close contact with the community, that we're not in some ways penalized because it takes longer. I would say in the School of Social Work, we're fortunate in that there are a lot of, I have a lot of colleagues that have managed to do that and succeed. So that's great. I'm just not sure how it works in other departments, where maybe it might be a little bit more challenging. But as a School of Social Work, it is imperative that we be in contact with community, and that space be as much as possible bridged.
Thank you for mentioning that, because I feel like that was one of the main struggles I had with coming back to school, thinking, okay, now you're going to be part of academia and just, sit in a classroom and talk about things, but you're not actually doing things. So knowing that as you advance in your career, maybe you become a researcher or a professor, you're still, at least in the School of Social Work, trying to involve the community. You're still not out of touch with lived experiences of people. So yeah, I appreciate to hear that. So as we approach the end of our conversation, I wanted to ask you about your teaching role, which is what we mostly know you about. What have you been enjoying? How has it been teaching us? And I think you also teach in the MSW, if I'm correct.
I don't.
Okay.
I only teach at the BSW level, and I'd say that I'm really fortunate, I think. I'm
Mm,
really fortunate to be in this position because I get to shape future social workers. And that is like, I think it's a privilege, but it's also a huge responsibility, but one that I'm really grateful for uh, because I've worked as a social worker and I know my colleagues
mhm,
and I know what, you know, so in some ways, we're talking about like the micro and like the macro, and how does my experience as a social worker inform my research? It also informs my teaching because I really feel that um, in this position, I'm able to, as much as possible, get the social workers that come through our doors to think, about the macro in their micro practice. And that is like something that I'm happy to do, and that I see as very important. And I'm still trying to figure out the best way to teach that because it's not, it's very abstract, and we have our seminar class together where we're talking about what does micro macro practice look like. Um, and I think also students come into the field with an idea of what social work is, um, that is social work, but not all social work. Um, and I also think that, and this is not just specific to, our school, but the profession of social work is rooted in like, is born from white femininity and all of the problems that that poses for, people that look like me, and you, and our indigenous brothers and sisters. And so this whiteness in our profession is so insidious, and having to strip it, I think I try to I try to unpack that and to really speak to it in the classes that I teach. But there is like, there is resistance, and I see that resistance sometimes in terms of, why are we always talking about the bad about social work? Like, why don't we ever talk about the good? And I guess there is good about social work, but I think we've just historically kind of ignored the bad. And actually, I'm sorry, I don't know if it's productive to think about the profession as good or bad. But we've done bad things, and I think that we need to come to terms with that before we can hope to achieve good. And that is something that, like, even the nuance of that, it's something that I grapple with, and it's something that I'm still, trying to find my footing in teaching at the undergrad level, beyond just like, because I could teach you how to do an assessment, what information to put here and there, and that's easy. But what's difficult is is how to be. It's how you are um, in this profession, the relational aspects of it, and um, your way of being. I don't know how to put it in another way, right?
yes, yes.
And also the recognition that a lot of social work, you know, there's a big problem in social work because, you know, a lot of us are working in, you know, services that are voluntary. So in the CLSCs, um, and we know that those CLSCs are serving, you know, diverse populations, but yet um, a lot of like Black, Indigenous, and other racialized communities are underrepresented in those systems, despite knowing that the need, you know, is there. They're just not going to those services. Part of that is because perhaps they don't see themselves reflected in those services, but also perhaps part of it is um, the way that we as social work, our profession currently is, um, in terms of, you know, constructs of professionalism, boundaries, procedures, um, bureaucracy, um, you know, and what we learn, you know, so the theories that are very much like individual focused, so attachment theory, um, and how that sometimes doesn't capture the entirety of the person. And in some ways, you know, or in somehow, you know, it is very like deficit focused. So yeah, I teaching has been great, you know, and I'm still figuring it out, and I'm still, you know, trying to find ways um, to to um, to transmit the complexity that social work is, as a way of being, um, rather than just focusing on like the skills, right? And I realized that I think you have to do both, because without like skills, right, or without like some type of foundation, then it's kind of like you're just floundering. So I'm still learning how to not let my students flounder, and to like this balance of, okay, like here's some solid, like here's like a foundation of skills, so that you're not floundering, but you're still, even with those skills, like you're still gonna be, you know, struggling, because that's just what this profession is. I think.
Definitely. Yeah. And I'm smiling because I mean I've been your student for 2 times now, and I remember specifically having a conversation with you for an assignment, and it deconstructed everything I was thinking, you know. I took a nap. I went to bed and took a nap because I was like, what was that? Where am I now? What, who am I? You know? And I think that was a very important aspect of knowing how did you say it? Like who you are and how you are in social work and how you carry yourself in social work, so that we're not all over the place and obsessed with the tools and the skills and, you know, the problems that are there, but who are you in all of that? So thank you so much for challenging us and for asking the hard questions, and, you know, pushing us to find our footing in there, and to look at the bigger picture as we navigate the smaller pictures as well. So yeah, thank you. Oh wow, I've kept you for so long, and I know we talked a lot about your teaching role and your research. Alicia, thank you so much for who you are. You did mention a little bit about representation, and for me, being a Black woman, seeing you is just it's just something, gives me a little way of knowing that I'm stepping into someone else's room, that I'm not a stranger where I'm walking by, and there are people like you and other professors that kind of like portray who I want to be. They're there doing the thing. So I really enjoy sharing a learning space with you, and yeah, you're very, very important for us.
Thank you,
Yeah.
Eddie.
Thank you. Well, I wish you, Enjoy the rest of your day. Again, we are with Professor Alicia Kyte. My name is Alice. By the way, I forgot to introduce myself. Alice Shime, I'm in my last year of the BSW, and we were talking with Professor Alicia. Well, have a good day. Thank you.
Thank you.